Dreaming of a better sleep? Tossing and turning is not your destiny. And Ollie is here to help. Ollie invites you to sink into sweet, sweet slumber to improve your mental and physical health and overall wellness. More than just melatonin, Ollie's ingredients help you unwind your mind for a delightfully dreamy drift off. Sleep is on the way at Ollie.com. That's OLLY.com.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by a guest pediatrician bestie, Dr. Erin Faherty, who's a pediatric cardiologist who treats kiddos at Yale New Haven Children's Hospital. She also went to med school with my husband, Ethan, so this is a very special episode for me. Today, we are going to talk about chest pain in kids. The clock is ticking, so let's get to it. All right, Erin, so how common is chest pain in kids?
So chest pain in kids and adolescents is actually quite common. Fortunately, cardiac causes of chest pain in kids and adolescents is quite rare. In fact, I'd say more than 95% of the time, chest pain in children isn't from the heart.
Interesting. What are the other causes of chest pain?
So outside of the heart, common causes of chest pain may include musculoskeletal pain. Sometimes it can even kind of like growing pains in the ribs and muscles in the chest. Other times it can be from GI issues, reflux, indigestion. Sometimes respiratory causes, asthma, other breathing problems can sometimes present as chest pain. And so those are some of the common causes of non-cardiac chest pain in kids.
Got it. So how do you, as a cardiologist, evaluate a patient who comes in with chest pain?
So as a pediatric cardiologist, we'll take time to obtain a really careful and complete history, as the history will actually help us determine how worried or not worried to be for underlying cardiac cause. Specifically, we'll ask questions about the quality of the chest pain, the location of the chest pain, as well as when the chest pain occurs, such as does it happen with activity, does it happen with rest, and how long the chest pain lasts. Pediatric cardiologists will also perform a thorough physical exam, and a family history will also be obtained, as some causes of cardiac chest pain can be genetic and can run in families.
Got it. So what testing may a pediatric cardiologist perform for a patient who comes in with chest pain?
So often a electrocardiogram or an EKG will be obtained, and this looks at the rhythm of the heart. It also serves as a reasonable screening tool for evidence of heart enlargement or thickening or heart damage. Other testing may include an echocardiogram. So that's when a cardiologist performs an ultrasound of the heart. And this looks at the structure and the function of the heart. And occasionally, based on the history or physical exam, a cardiologist may obtain a couple other tests. One of those may include a Holter monitor. So this is a monitor that a patient actually will go home with and wear for a day or two. And this tracks the heart rhythm over the time that they wear the monitor and can give more information about if a patient's possibly experiencing a heart rhythm or palpitations that for younger kids sometimes can actually feel like chest pain, or they can describe it as chest pain when really it's a heart rhythm issue. Additional testing may include an exercise stress test. And so that's when a patient will actually be put on a treadmill or an exercise bike, and the heart is monitored, and we essentially monitor how well the heart tolerates that exertion.
Got it. So when should a child see a cardiologist for chest pain? Because I'm sure there are parents listening who are like, all right, when is it time to actually schedule a visit? So can you comment on that?
Yeah, as a parent, chest pain is scary in your child. And so as a pediatric cardiologist, chest pain with exercise or physical activity, chest pain associated with fainting or nearly fainting or dizziness, or chest pain with palpitations or breathing problems, all raise our suspicion for a possible cardiac cause. And so any of these symptoms with chest pain would certainly makes us want to, as a pediatric cardiologist, evaluate that child. And of course, if a parent has any concerns regarding chest pain, we always also encourage reaching out to your pediatrician, as pediatricians are also great at evaluating kids with chest pain and helping to facilitate a visit with a pediatric cardiologist if there's concerns.
All right. Well, I learned something. We hope you learned something, and we have lots more to share. Special thanks to Dr. Erin Faherty, pediatric cardiologist, for her time and expertise. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.